Okay, what is your name?
I'm Dr. Edward Bednar Cosmetic Surgery.
Great. How did you get involved in hair restoration?
Well, I got involved with hair restoration quite some time ago, and as you know, it was actually with the individuals that were in the hair replacement industry here. Hair restoration from the surgical side underwent some major changes in the latter 80s, and it was really plastic surgeons in the early 80s who developed the individual follicular hair restoration procedure itself. So by the 90s, it was hitting a height of popularity, and we became involved. In fact, we made proposals to some very large players in the hair industry, and they, at that time, didn't see well enough into the future that this was going to be quite a trend, and didn't accept it at that time, but now they're involved in it, interestingly enough.
Took them a little while to come around.
I was going to say, it takes a little bit of a while sometimes to get the big boys to come around.
Okay, tell us about how you like to approach hair restoration.
Well, from the standpoint of the approach, we sit down with the patient on an individual consultation, and sometimes that occurs on Skype. I mean, we have patients, we have an international practice, not just in hair restoration, but across the board. And so we'll sit down with the patient in a consultation, either as a one-on-one, or we'll sit down with them in a video kind of interview, and we'll discuss what they're really hoping to achieve. It also allows me to really inspect, in a way, where they are in the hair loss process. And so from that standpoint, we can come up with a game plan for them.
Okay, now as far as do you tell us about the other areas of your practice over here? I understand that you're a plastic surgeon, correct?
My areas of practice, include the full realm of the cosmetic surgery procedures. And so from that aspect, it's not just hair restoration that we approach, but we do a full of body contouring, body sculpting procedures, the breast procedures. We do a lot of the rejuvenation procedures, the facial rejuvenation procedures. We do a lot of the fat transfer procedures, which is a regenerative mechanism. So it is all along the lines of very much like the restoration processes that we've talked about. It's moving towards the regenerative issues here. We're taping.
All right, let's see. Tell us about your approach to the hairline.
Well, basically the approach to the hairline is not unlike the approaches I make in all of my cosmetic procedures. It's a very artistic endeavor. And from the standpoint of practicing, the artistic, philosophy is applied to all the procedures that I do, and this procedure especially, because what happens is that if you don't apply artistic principles, then you're going to end up with a hairline that does not fit that individual person. And so there's a lot of things involved. There's proportions that are involved. There's symmetries and asymmetries which are naturally occurring in individuals. There's differences in cheekbone structure from one side of the face to the other side of the face that affect how you really need to draw the hairline. So
hang on one second. I'm going to ask that question again, but before I do, tell me about your background as an artist.
Okay. My background in art goes back to the time of 8 years of age. I paint and I carve and I sculpt, and I have been doing that since I was 8 years of age. And so that kind of aptitude I bring to the table every day. And so I sculpt in clay, I carve in wood, I paint, in most mediums. They're all a little different artistic process. They're all a little bit different artistic approach. And so all of those things help when you're really looking at a patient and you're trying to basically provide for them the ultimate in their end result. And that is an individualized result, something that is artistically pleasing to the eye.
How does that artistic background help when it comes to hairline design?
My artistic background when it comes to hairline design helps a lot because I know and understand what topography means, and topography from an artistic standpoint, how proportions relate to one another, how your focal point, say in a sculpture or in a painting or in someone's face, really provides for a natural flow of your eye's line and scan. And when you take all of these things into account, then really you're going to be plotting a hairline that looks more natural on that individual than the formula of, say, drawing this pattern or this parabola or this kind of thing and using a formula or a certain number of centimeters. It's not that. Each individual is so much different, even from one side of their face to the other, that you've got to make an account for all those differences and really use artistic principles in order to design a hairline.
Now, from my experience in the industry, I've seen that a lot of doctors that are doing hair restoration surgery are doing exactly that. They're drawing a line from temple to temple. Okay, how do you feel that technically your approach is a little bit different?
Rather than drawing a line from temple to temple or using a formula, what I want to do is I step back from the patient. I basically have them smile, I have them frown, I have them raise their brows. Okay, I use subtle markers that may be some of the residual hairs, but then I step back and I say, okay, are all these factors going to be taken into account when we design the hairline? And then I begin the process of tracing the hairline on there. And I'm stepping back and forth, just like I do with a painting and just like I do with a sculpture. And it's all that sense of proportion. It's all those things that, for the most part, some of it's learned and some of it, believe it or not, is intuitive from a genetic hardwiring that an artist has, and it's rather unique.
Okay, what do you feel that you do differently, or tell us a little bit about anesthesia with your patients for surgical hair restoration?
When we go to applying an anesthetic regimen to each patient, we're going to individualize it. All right, we'll use, the oral sedation is based on the patient's, I think, background and experiences in prior maybe procedures. But also we're going to individualize it from the standpoint is that we can use formal nerve blocks, we can use the ring blocks, and we can use the crown blocks. But whatever it takes, I always tell the patient, look, it will not take me very long to anesthetize this area under the local block. And so in preparing them for that and getting them through the process and buffering things a little bit, it really makes that process, as I said, very straightforward. And I think patients appreciate that.
Okay. What is platelet-rich plasma?
Well, platelet-rich plasma is a concentration of the platelet portion of your plasma, your blood. Okay, so from the standpoint of what you're trying to do is you're basically taking a signaling factor, which is what a platelet is, and when it lyses, it provides all kinds of nice signals in regards to wound healing growth factors, cytokines, and it attracts and provides signals in a healing process. And a lot of these things that occur in a natural process when you cut yourself, or you get a bruise or a bleeding in the wound, so it's part of extending that natural healing process to the wounds in which we want to give those correct signals for healing. Yeah.
Okay, now how do you perform that procedure as it relates to hair restoration?
In regards to hair restoration, if the patient is of a mind that he wants to use some of those additional factors to maximize the kind of result that we're going to see, as well as the factors that are stimulating the new hair follicles and its growth, then what we do is we take and draw a couple of tubes of blood and we process them. I mean, it is a kit that's processed. This is nothing new. This is material that's been around for quite some time. And we process, spin it down, and we use it in an injectable form. And that, from that standpoint, what we use it, in the scalp region is because we want those signals there.
Now, who are good candidates for platelet-rich plasma?
I think everybody's going to benefit from platelet-rich plasma if they know and understand what it is. It doesn't necessarily fit everyone's budget, and the reason for that is it's not, an inexpensive portion of the procedure to add. So from that standpoint, a lot of the costs comes down to the kits, okay? And I don't think people really realize that. We may tell you the cost, but majority of the cost may be in the materials that we're using to process the platelets themselves.
So let's say a patient is a class 6. Okay, you're saying that they might get some benefit from this, even if they have their hair loss is pretty severe.
Well, you want to maximize everyone's result as much as possible, but a class 6 especially. You have very little hair there in the donor site itself. So what you're trying to do is you're trying to maximize not only the take, but you're going to try and maximize signaling factors. And we know from more recent work, especially over the last decade, we know that there are signaling factors that can stimulate some additional hair growth or a multiplying of some of the follicular products.
Okay, roughly ballpark, what would it cost for, say, a class 6 to come in and wants to start out with PRP?
When you're a class 6, you've got to be realistic about what can be accomplished for you and the amount of donor hair that you really have. And when we sit down with that individual, we basically come up with a multi-stage approach. And the reason for that is we can only do so much in a single setting. It's not just from a comfort standpoint, but from the technical standpoint and how close you're placing hair follicles. You want the little bridge of skin to be able to retain the hair follicles. So we tell them this is a multi-stage procedure, okay? And it may take 2 or 3. We may not have enough donor hair to go to the 3rd session. And I try to paint a realistic expectation of what they can expect from the standpoint of density. Because you're not going to end up with the same density in each individual, and you're certainly not going to end up with the same density in a class 6 because you don't have necessarily as much donor hair in order to cover those particular areas. So come up with a good game plan. What is expected? What areas are we going to really try to cover? Where are we going to focus? And I always try to tell patients in this stage is that if you focus on the frontal line, if you focus on the central frontal areas, you're going to end up with a more acceptable result because you'll get some density. But if you try to cover the entire area, that's not maybe a realistic approach.
All right, now, when we're talking about some of your answers were talking about doing it in conjunction with a surgical hair restoration procedure. Now, let's say a class 3 vertex comes in that doesn't want a surgical procedure. Is that somebody that you would consider a PRP without?
Yeah. I consider that when someone comes in a class who doesn't necessarily want a surgical procedure, I tell them, okay, the studies that we have and the mix that we have from the non-surgical kinds of approaches, including utilization of the platelet-rich plasma, including utilization of the acellular dermal matrix materials that are available, we can provide kind of an injection therapy that hopefully stimulates the underlying mechanisms here to maintain what you have as well as to kind of awaken some of those things that are undergoing the early process of their miniaturization. So if we can approach things from the non-surgical side, then we do that. Increasing blood flow through laser therapy is another way to do it. That provides for miniaturization. Some of the drug therapies are another things that you can do. But when it comes down to your choices now, you have multiple. And it's interesting, we know that in our studies, we understand that there's a great individual variability from patient to patient in regards to how they respond to our early regenerative processes here. And that's what I was talking about. PRP is a signaling process. Acellular dermal matrix is another part of the signaling process. These are what we term regenerative mechanisms, and where we're trying to reawaken the endogenous cells that are undergoing a loss or the fallout. And so from that standpoint, what we're doing is we're taking what's available. Not everybody, and that's the key part of that consultation, not everybody's going to have the same response. It's pretty dramatic in some people. It's really amazing, which is what gets you excited. But at the same time, it's not as great a result in other individuals. But we're beginning to understand that how cells are stimulated and certain factors from individual to individual really affect that response. It's not universal. And until we can kind of figure out all those variables, we're not going to be able to provide necessarily a universal response yet. This is in the early stages of a process.
Ballpark for a 3 vertex as far as what the kit may cost in the actual procedure itself.
You're talking about ballpark for what?
If a 3 vertex came and
you're talking about for PRP.
For PRP.
Yeah, we started. It depends on what we are using. For the PRP alone itself, it started at about a $1,500 cost. Okay. And when you process through, if you're using an acellular dermal matrix in addition to that, again, terribly expensive materials. The FDA has not done us any favors in regards to, it has increased the cost of medicine, but at least we're providing some cutting edge kinds of technologies. So again, you may go into the $2,200 to $2,500 range when you're treating something like a vertex.
Where do you think hair restoration is going to be 5 years from now?
I think hair restoration 5 years from now might advance to a point where we are able to predict a little bit more that kind of universal process where we can get the regenerative processes working a little bit better. What I mean by that is that can we figure out why PRP and acytodermal matrix really works in certain individuals and why it doesn't work in others. At the same time, we've got a lot of things that are occurring in the laboratory, and it has a lot to do with the stem cell technologies. It has a lot to do with the progenitor cell technologies. And what I mean by that is that there's dermal papillar cells, there's dermal sheath cells. In the laboratory, we've been able to pull these cells off, and we've been able to grow them at times in culture. We're growing them in 3D matrix cultures where they're actually of benefit, and there's signaling factors that are maintained. We're just in that early process of figuring out how we can use all the regenerative mechanisms, both our signaling factors and our cellular factors. How soon we get to something, maybe 5 years is a little ambitious because of the cellular processes. If you're culturing something outside of the body, then the FDA is going to look at it, as a little bit more long-term study. But if we can get signaling factors and some of those cells endogenously working together, then I think we can make a leap in the next 5 years towards more regenerative hair processes. And it may still include the transplant types of surgeries, but we'll be utilizing a little bit more in the mix.
If you were talking to somebody that was thinking about doing something for their hair loss, okay, and was sort of on the fence about moving forward, what would you tell somebody about the new technologies versus what was available 20 years ago?
Well, 20 years ago, of course, as I said, was the advent of really where we've kind of matured things now. Now, are you going to make tremendous leaps over the next 5 to 10 years? Probably not. So you need to take advantage of what we do have to offer right now, as I said before. And it's not burning any bridges. In other words, as new technologies come along, they're going to be of benefit to any individual who's suffering from hair loss. So again, waiting for the next thing, I can honestly tell you, it may be a long wait for you. Not worth the wait. There's plenty of options for you now.
Okay, that's...
That covers it?
That covers it. You've done well.
Let me see this guy.
Oops.